worked. You eventually got a negative ANA test after 20 years, I understand. So that is huge.
It is.
And you kind of already touched on what that did, like how that shifted your perspective back in your 20s when you made that choice that I'm going to live my life. So how did getting a negative ANA test, how did that shift your perspective on your health 20 years later?
So I think to answer that, I'm going to back up just a little bit to kind of what I chose to do to achieve that negative ANA. When I had my son when I was 25, and of course, with lupus, pregnancy is high risk. They told me, pregnancy is high risk. I did not comprehend at all at the time that what that meant was that with an ANA, which is, I assume since you talk about this that your listeners probably know what an anti-nuclear antibody is. Since since your antibody attacks the nucleus of a cell, which is the energy of a cell, and that with lupus it's indiscriminate, right? It'll attack anything. That means it can attack fetal cells just as easily as kidney cells or my eyes or my skin, which I was dealing with. I didn't comprehend that at the time. I just, I did have difficult pregnancies. My babies were small. They both went straight into ICU or NICU. After I had my son, I couldn't stop crying. For months, I just cried and cried. And I was really fortunate because I had an OB, nurse practitioner, who said, sometimes when people have children, have babies, it brings up their own issues, right? From your own past. Here's the name of a really good therapist. Therapy was really, and I am answering this question. Therapy led to my ability to have a negative ANA. Facing my own demons, facing my own past, because, as women, we all know that most of us have trauma in our childhoods, right? In our past. And that they found, I don't know, The Body Keeps the Score. I'm sure you've talked about that, right?
Yep, I'm reading it right now.
It's so good. Yeah, right? It's so good. And it was for me, that book is so validating because it's exactly what I went through to have a negative ANA. But I just did it. I just did it. But now it's yep, that's what I did. Yep, that's exactly it. And having therapy and facing those things and being able to tell my story and feel safe again was a lot of, help me move the bar, help me feel worth moving the bar for. So after I was diagnosed, I'm a researcher. My degree's in English literature. So I'm a researcher. I taught middle school literacy for a decade. When I found out what a positive ANA means, when they would say there's no cure, you can't cure lupus, because when you have an antibody in your body, that's the antibody's job, is to live in your body and to attack the things that it's programmed to attack. It won't ever go away. That's what an antibody is. That's what they told me.